Hi, I'm Dr. Pradeepa, Vice President and Senior Fertility Consultant, Sudha Hospitals. So, I'm just going to give a glimpse of the best days to try for pregnancy. So, this is a commonly asked question from young couple. They ask routinely, like which are the fertile period and which time, very ideal time to try for natural pregnancy. So normally a menstrual cycle on an average is about 28 to 30 days cycle. This is a normal regular menstrual cycle. First 14 days is naturally called a follicular phase of the cycle. And the next 14 to 15 days is called the luteal phase of the cycle. So the first follicular phase, the hormones are totally different, and the second half of the cycle, the hormones are totally different. The transition involved in these two phases, release of follicle from a mature, release of oocyte from a mature follicle. So this process is called ovulation. So when does this ovulation actually occur? So the ovulation has to occur whether to get a regular cycles in the next 14 days or to get pregnancy. Ovulation period is around 10 to 14th day of a natural 30-day cycle. That is 14 days immediately after ovulation. Women will get either her cycles or if she had tried for pregnancy, a natural pregnancy. How to calculate in patients with irregular cycles? Because in irregular cycles, we can say it's around 10 to 14 days. But how to calculate in irregular cycles? In irregular cycle patients, of course, calculating this fertile period is little bit difficult. So here comes like various tests to monitor ovulation as well as to detect ovulation. Regular cycle, how to predict ovulation so that couple can try pregnancy in the fertile period. So during this period, normally when follic ovary releases an oocyte, the fallopian tube of the woman just picks up the egg and it meets the sperm. Suppose a couple had intercourse around the fertile period, then it meets the sperm in the fallopian tube, forms an embryo, and the embryo gradually swims through the fallopian tube into the uterus and gets implanted in the uterus. So this is the natural process happening. For this, ovulation has to occur properly. So how can we diagnose by our own clinical symptoms that a woman is ovulating? During ovulation, generally the woman will have a little bit symptoms of natural bloating. So due to the hormone shift, they'll have increased weight gain and a bloating sensation. Also, they'll have a breast tenderness, and sometimes a woman may experience a sharp pain, maybe in the right side or left side, depending on the side in which the egg is released. Or sometimes she may also complain a little bit spotting around the 14th day of the cycle. So the pain which experiences a spotting is called the Mittelschmerz pain. These are the various general symptoms this may encounter, and some women exactly say this is my day of ovulation by these symptoms. And generally the cervical mucus, so normally the cervix is the mouth of the uterus. So from the cervix there will be a mucoid discharge. This is natural for a woman to have a discharge, but around ovulation this mucoid discharge becomes more watery, slippery and increased in amount. Lady can diagnose that she is going to ovulate depending on the change in the consistency of the cervical mucus which she has. And second thing is she may have little bit increased in the basal body temperature. So the temperature almost rises by 0.5 degrees Celsius around the time of ovulation. So these are the general symptoms with which we can diagnose, okay, she is ovulating. What are the clinical investigations to diagnose ovulation? So we can diagnose ovulation by doing certain hormone profile like LH and progesterone levels, as well as by seeing the definitive diagnosis is seeing ultrasound. So it doesn't mean that every woman needs an ultrasound to monitor ovulation, because if she has regular cycles, the following symptoms, we can educate her properly that this is your fertile period 10 to 14 days. And once the sperm comes, it around 72 hours, but the eggs are alive almost 12 to 24 hours. So even 2 to 3 days before, if she had intercourse before the fertile period also, there are chances of getting pregnancy in the cycle. So this is the thing we educate them. Suppose if they are not successful or they have irregular cycles, then comes a transvaginal ultrasound. So this plays a very important role in doing a follicular tracking from second day of the cycle. We can track her follicle, monitor her follicle, see the increase in the size of the follicle. Once when ovulation occurs, the follicle size shrinks, it collapses, and we can see a fluid in the pouch of Douglas due to the rupture of the follicle. So this is a definitive sign of ovulation. I think clinical symptoms with ultrasound with hormone profile exactly documents ovulation status. So this is the fertile period, and depending on this follicular study and natural signs, I think a couple can try to get pregnant fast. Before 10th day or after 14 days, the chances of pregnancy are low in a natural cycle, when normal 30-day cycle, but in an irregular cycles, the ovulation may be delayed and she may have conception at a later date also. Some urinary kits like LH kits are available which help in detecting at home the ovulation. So they are using LH kits also to predict ovulation. So all this are available to detect the exact fertile period. So knowledge about fertile period is important for a young couple to try for natural pregnancy.